He was examined by a doctor at Jamaica Hospital.
Right here in
And
Queens, right?
yes, and the doctor said that, it's either his liver or his kidney. So she did an ultrasound and found out that he had polycystic kidneys.
And he was examined. Why? What were his symptoms?
His kidney were his stomach, sorry, were very enlarged.
Right.
And, he was not able to keep the formula that they were giving to him down. He was, vomiting a lot. So they decided to run the test to see, what was wrong.
And when did you actually get a diagnosis?
5 days after I had him. That was in March. It was sometime in April.
Right.
Yeah.
Okay, and that was 14 years ago?
Yeah, 14 years ago.
So then you got a diagnosis. What did the doctor say to you?
Well, she said, your son has something they call polycystic kidneys, and he will have to have a transplant in the future.
He'll have to have a kidney
transplant.
And that must have hit you like a ton of bricks.
I mean, I had no idea what she was talking about. No idea, because I was not familiar with the disease.
And you've just given birth 5 days ago.
Yeah.
You're exhausted.
And he was transferred to New York Presbyterian in Manhattan, where he was treated by Dr. Valerie Johnson. And there is where he's been since then, So it's been a struggle.
Right. And how do you feel, Justin?
I feel great.
Yeah?
Yeah.
Did you always feel good?
Yeah. The problem never really bothered me. So I just feel normal.
Yeah. Do you think it's because that's just what you've always known?
Probably, yeah.
Yeah? You look great. So tell me about basketball. What's your favorite position to play?
Point guard.
Why?
Because apparently I'm the smallest one on the court, so that's my position to fit.
When did you start playing basketball?
6th grade.
Okay, so you've been playing for a little while.
Yeah.
Good. And the best treatment, I guess, for PKD is a kidney transplant.
Yes, if you have one available.
Right.
I mean, yeah.
So what happened there? How did you get a transplant? We were at 5 days old. He was transferred to another hospital in Manhattan, and then he started treatment. And when he was ready to go home, what happened?
Well, when he was ready to go home, it was a big deal because I myself had to be trained how to take care of him, giving injections to the medication. He had a G-tube.
And what's a G-tube?
It's a tube that they put in that he could get his medicine in his stomach.
Right, and it was right
here,
right?
Right, yeah. It, he was on a lot of medicine. He couldn't take a pill, so most of his medicine were liquid.
Right.
And, he had to get it like that. The G-tube was for the purpose of him getting his medicine and being fed.
Right.
He was on 24 hours feeding. On a kangaroo pump.
What's that?
It's a pump that, it's something like an IV that is connected to the G-tube, and he get his feeding from there.
Wow.
His formula.
When did he finally come home?
2.5 months later.
2.5 months in the hospital.
Yes, yes.
You must have been on pins and needles.
Oh my God, I used to be there Sunday to Sunday.
Yeah.
8-9 hours a day. It was a trip because I'm coming from Queens to Manhattan, where I have to take 3 trains and a bus. So it was a journey for me every day. But I did it.
Of course, yeah. Oh my gosh. So then you get him home and you're learning how to use the tube. You're learning about all the different medications. And that just became life.
Yeah, well, you know what? It became normal after a period of time. It took me like about 6 months to not look at the chart anymore, to just, memorize everything as to what I have to do. But, I had a nurse, always had to have a nurse because I couldn't do it by myself.
Right.
I was out of work for 1 year. In '99, I didn't work at all. And then I got a nurse, and, it was a big help for me.
Yeah.
to do, taking care of Justin.
And it must have been overwhelming because you're not a trained medical professional.
No, I'm not.
Right.
No.
So then, when did you know Justin would need a transplant? When did they, I know they told you that he would eventually need one, but when did they get serious?
Well, when he was, 8 years old, his, the levels of his, the function of his kidney started, going up. And then Dr. Johnson said, we have to start, looking into the transplant. So his dad was tested, and he kept himself, very well healthy.
Right.
Make sure that he kept himself, healthy for Justin to get a kidney.
Right.
And
You've got a great dad.
Yeah.
He loves you a lot.
He's
Yeah.
an amazing person, very nice, yeah. And Justin, the reason he didn't get the transplant from younger, they had, polycystic means, kidney means, enlarged kidneys with cysts, but Justin, to accommodate his father kidney, he had to grow a little bit, to have the room
Right. The
to
actual
accommodate,
room for the physical kidney.
yeah,
Right?
yes.
So Dad donated his kidney, one of his two.
Yes.
So you got one new kidney. Which side?
My right side.
Okay. And what about the other side? What about the other kidney?
The left side is my kidney, my own kidney. And the doctor said that it would eventually shrink and dispose of itself.
Okay. So no more surgery.
No.
Great. And so it's still in there, but it's not functional, obviously.
Right.
Okay. So you got your dad's really good kidney.
Yeah.
So your dad's here with us now.
Yep.
He's like our third guest.
Yeah.
So walk us through the transplant process. Your dad was here and he was in the hospital with you, so they took a kidney out. What happened?
They took the kidney out and they gave it to Justin. He was out in about maybe 2.5 hours. Justin stayed in for like about 3.5, almost 4 hours.
In surgery?
Yes. Then he came out and, he was doing fine. They had him in the hospital. He was there. His dad was discharged. He came home like about 2 or 3 days after. Justin stayed, and 5 days after or 4 or 5 days after the transplant, his belly started, getting even more enlarged.
Oh my gosh.
And he was crying a lot. He was in a lot of pain. So then they did an ultrasound to see what was going on, and his urine was leaking.
Right.
It was not attached properly. It had a leak, so it was like backing up, and they had to go back in.
Wow.
Yeah, to do a second surgery, open it up and go back in and reattach it. So that,
And then after that surgery?
Well, after that surgery, he stayed, and he came home, and he had to go back to the doctor. He got some infection. It was a long process.
Yeah.
He was hospitalized a couple of times after that. And since then, thank God, he's been doing really, really well. And his life is almost to normal.
You say almost.
Well, he has a lot of doctor's appointment to follow up. He's on a lot of medicine. He's on an injection for his immune system and stuff like that, but he has high blood pressure and he has to drink a lot of water.
Right, absolutely.
Yeah.
How are you doing with that?
I'm doing good as of now. I'm drinking a lot of water. I have like a big bottle about this, and I fill it up about 4 times a day and drink it.
Oh, great. Okay, good. So you're doing it.
Yeah.
Diligent. And you're on high blood pressure meds with one kidney.
Yeah.
Your blood pressure goes up. Yeah, so that's pretty normal. And tell me about the feeding tube, because you had the feeding tube from when you were little, and then you had the surgery, the transplant surgery at 8 years old. Did you still have the feeding tube after surgery?
Yes.
Why was that?
Because after surgery, they had to give me an anti-rejection medicine, and the only form of that medicine was a liquid, and I couldn't take it by mouth because it was just nasty. So they inserted it through my G-tube, which like basically gave it straight into the kidney, so it would stop, so it wouldn't reject my.
Right. Okay. And how long did you have the G-tube until?
I had it taken out in 2012.
Yeah?
Yeah.
What does it feel like? You've had it your whole life. What does it feel like to not have it now?
I feel normal now
Yeah.
because before, like, if I go to the pool or the beach or something, I would have something like a vest or something covering my body because I didn't like to like let people see it.
Yeah.
So now I could just take off my shirt when I go to the beach and the pool and stuff. So
Yeah, like every other kid.
yeah.
Oh, nice. Maybe you'll, do a little swimming in school now.
Yeah.
How cool would that be? Yeah. So before, when he had the feeding tube, after he got off of formula and everything, later on in his life as a growing boy, how did you feed Justin?
Well, what do you mean when he had the tube?
Yeah.
The tube, when he had the tube, I try my best for him to get all the nutritional value out of food. So I will wake up on mornings like about 5 o'clock. I had to go to work and the nurse comes in for me to leave. So I will wake up in the morning and I will make soup.
Right.
And I will put everything that I think will, he will get benefit from.
Like what?
I will put like pumpkin, I will put spinach, broccoli, split peas. Some days I'll put chicken, I'll put fish, I'll put, and make it nutritional for him. And then I will puree it.
So just puree it in the blender?
Yes, in the blender. I would, blend it really well. And then I would stand there and take the bulk out by, straining it in a thing to take the bulk out. And then I will put it in a container and put it in the refrigerator.
Broth that was left?
Yes. Put it in the refrigerator and the nurse would do bolus feeding for him through the day. Yeah.
And how often?
Every 2 hours.
Oh, wow. Yeah. So what was your school schedule like before? Were you going to school?
Yes, he was going to school, but he was going to private school because I was so scared to send him to public school. It's a larger crowd in public school, and I sent him to private school, and they didn't have a nurse in the school.
Oh, wow. So
I, myself and some other parents, he went to St. Mary Gates of Heaven in Queens, and we spoke to the principal, and he was very nice to us, and he got a nurse in.
Right.
So I used to take the feed, the soup there, and the nurse used to give it to him.
Wow. Right there
in school. Yeah.
So you could just stay in school all day.
Yes.
You didn't have to worry.
Yes.
Oh, that was awesome.
Yeah.
And then, so that was your life before, and you had, you were blending everything and feeding it, and just the smell of food made you nauseous?
Yeah, like in the morning I would wake up and she would be toasting bread for her for breakfast, and I would just run out of the kitchen because at that time the smell of toast made me nauseous.
Really?
Yeah.
Yeah. And you just couldn't eat any solid food?
No.
Wow. How did you look?
I was really skinny.
Yeah.
With a very big head.
Very skinny with a very big head.
Yeah.
And a big belly.
Yeah.
Oh, wow. You've totally grown into yourself.
Yeah.
You would never know, Justin.
No.
And so that was before. No, and it must have been breaking your heart, just cooking for yourself, bringing in, what every other kid eats, McDonald's or whatever, and Justin not being able to share.
Never. I always, when his dad is here with us, he comes like twice for the year, and whenever he's here, he try his best to give Justin fruits, which is something we couldn't get him to do. But now he's a little better. He still doesn't like fruit, and I try my best, and he's gotten better with it.
Fruit smoothies, nothing.
I drink fruit smoothies now.
Yeah.
Well, but back then I didn't eat as much fruits as I was supposed to. But now I've grown into it. I like the fruits now.
Nice. What's your favorite fruit?
Oranges.
Nice. Easy to peel too.
Yeah.
Love it. Can take it with you. So fruits. How did you introduce food to him after he could start eating food?
It's so funny. Justin never had bagel.
Right.
Or anything like that. But after the surgery, like 2 days after the surgery.
That's the transplant surgery.
Yeah, after the transplant surgery, he was asking for plain bagel toasted with butter.
Wow, why?
I don't know, like I just had the urge to eat that.
You'd seen it at home all these years.
Yeah. I'm like, you know what, I have to try it.
Yeah, what was it like?
Tasted good.
Yeah, is it one of your favorites still now?
Yeah, my favorite breakfast to eat.
Yeah. Oh, and it's funny because it's such a plain food.
Yeah.
Yeah, that's great. What are your other favorites? Pizza, pepperoni, of course.
Pepperoni pizza, hot dogs, French fries.
What do you like on your hot dog?
Mustard, ketchup, hot sauce.
Hot sauce. What about cultural foods? Have you introduced him to, I know you guys are from Trinidad, have you introduced him to a little dal puri and
Oh, he loved everything. He loved curry.
He loved curry.
Yeah.
Do you remember the first time you tasted curry?
Not really. I mean, like, because I was used to her cooking it at home even before the surgery.
Yeah.
So, I guess, like, I got used to it, the smell of it. And, like, the first time I tasted it, I thought of what it would taste like, and that's exactly what it tasted like.
Oh, like a hot,
like
unctuous, burny,
something
tasty, salty, sweet, everything all in one.
Yeah.
Oh, that's great. Other favorites?
Not really, just that.
That's great. What's your favorite food to cook for him now?
Well,
before it was just blending. Now?
Well, every time you ask him, and he would say, curry chicken.
I love that.
Curry chicken. He loved curry chicken. He liked something we make called macaroni pie and stew chicken. But he doesn't eat much of the chicken. He just like the gravy from it with the macaroni pie. He loved that. But I try not to make that too much.
What else can you do now that you couldn't do before your transplant?
Oh, well, I guess I could be more active. Like, I could go outside and play and not be scared of anything, I would think. But, yeah, I'm just more active now.
Yeah.
I think he has a lot more energy now than before the transplant. He would get very, very tired before the transplant. I mean, it still happens. You know, he get tired very fast, and he had a lot of pain in his, in his legs and his arms and everything. A lot of back pain and stuff like that.
How's the back pain?
Yeah.
It comes only after I play basketball. Like, if I play basketball too often or like too long, like my lower back starts to hurt really bad.
That's one of the side effects. Yeah, back pain with the kidney transplant too.
Yeah, and of late he's been getting a lot of cramps, and when he gets
leg cramps, or
like calf, like right here.
He would be on the floor.
Really?
Yeah, because it gets like so tight that it hurts.
He cries so much when he gets that. It's really bad, and then he would be sore for a couple of days. You know. But other than that, he's doing fine. You know, he like playing sports, but it's very dangerous for him.
Yes.
Contact sports.
Yeah.
Right.
Yeah.
Yeah. So what's the happy medium with playing sports now that you can, in a limited capacity?
Yeah.
What's the compromise? You can play, but
I could play, but I could only do like one-on-one competitions, which I really don't like as much.
He cannot play, you know, competitive, like in a group of people, because I mean they wouldn't know what's going on with him, and they're playing basketball. They would not be looking out for him. They would be looking to score, you know, or dunk or whatever it is they call it.
Mom's not up on the basketball league.
No.
Yeah, so you know, he could get hurt, and he could get hurt really bad. You know, Dr. Johnson told him that the kidney, you know, if he get hit the wrong way, it could crack the kidney, and then we will end up in a bigger problem, you know. So Justin is not understanding that too well.
Yeah, it's hard.
But it's you know, we're trying to let him know is the safest thing to do. You know, because we can't go out there and get another kidney for him.
Yeah. You've got to take care of the one you got.
Yeah.
Yeah. So what's your future looking like now, Justin?
Well, I hope to be successful in school and hoping to be a pharmacist when I grow up.
Really? Oh, great. Mom must be happy.
Yeah, well, first he wanted to do forensic science, but now he's been looking online and seeing, you know, who makes more money and stuff like that. So he's concentrating and focusing on pharmacy.
Great. All right. And you're 14. When's your birthday?
March 30th.
All right. So you're coming up on a birthday.
Yeah.
Happy birthday.
Thank you.
And what do you want for your birthday?
It's a long list, so I just say I want money.
You're just a typical 14-year-old. I love it.
He told me this morning, oh, I want an iPhone. I said, okay.
Yeah. Maybe next year.
Yeah.
And so after high school, you want to go to college? Any ideas where?
Well, before knowing that I couldn't play competitive basketball, I was thinking to go to a good college that has a good basketball team. But now I'm just thinking, like, I can't play it competitively, so I might as well go to a school that has something that I like. So I might want to go to St. John's.
Pharmacy school?
Yeah, or like any school that has that, like, it like revolves around science, like a science college.
Right. So you could study one of the sciences.
Yeah.
Yeah. Mom, Sandra, we're sitting here talking about college and pharmacy school and basketball and pizza. Did you ever think when Justin was 5 years old that you would be where you are right now?
Oh, no.
So hopeful about his future?
No, I was so scared. At some point, you know, when he gets sick, I always wonder if he's going to make it, you know. But what gave me, you know, the confidence and the hope that I had was Dr. Johnson and her team. They always, you know, she always returned my calls. She always, you know, talked to me and explained everything, and always, you know, she was always there. And it's been, you know, hard, but been a long journey.
Yeah.
And we this far with it now. So, you know, I just, you know, hopefully that, you know, we will get through.
Who was your support system during all this?
Well, you know, I have two older kids. They were very, very supportive.
How so?
Just and dad, and I have my brother and my sister-in-law and my nieces and stuff like that. And New York Presbyterian, the social workers, Dr. Johnson, receptionist, Wanda. She's an amazing person.
Really?
She is. She was always there. She knows about everything. She always, you know, had me with the right connections. Right. And she always makes sure that Justin, you know, was involved in all the programs that it have and stuff like that. So, you know, she was a big part of the support team that we had.
If there's someone watching right now who's finding out, like you did when Justin was 5 days old, that their child has PKD, what advice would you give them?
There's hope. There is hope, and the research that they do and all the, you know, the stuff, the medicine that is out there and everything, there is hope. And, you know, it's hard for a parent, and me raising Justin as a single parent, it was really tough, you know. But I mean, I had a lot of support, as I said, and, you know, it's just you just have to read a lot, and you have to kind of like find answers for yourself, read, find out about what you're dealing with, and just, you know, try to live a normal life. What are you going to do? There's nothing that you could do to change it. It's already there. And, you know, just do the right thing. Make sure you know, the medicine is the most important thing. The doctor's appointments, keep up with everything. Trust the doctors. They know what they're doing.
So get outside help.
Yes.
Do some research.
Yes.
Trust your doctors.
Of course. The doctors is the most important ones.
And don't miss your doctor's appointments.
No, don't. Do not miss your doctor's appointment.
Sound advice. Great advice. And just do some research.
Exactly.
Yeah. Did you feel better after you learned more about the disease?
Yes.
Yeah.
Yes. Well, actually, I thought, you know, when they said transplant and all of that, I was so confused. I didn't know, you know, what was the next step, until I went to the hospital and I met with Dr. Johnson, and I sit there and I spoke to her, and she explained everything to me. I felt so much better, because I know, okay, he's not going to die.
Right.
You know, I'm not going to lose my son, but there's more that I have to learn about.
Right.
You know, and that's my reason for being there every day. 8 hours, 9 hours a day. I will sit there and I would look and see what the nurses are doing and try to educate myself as to, you know, how to take care of him.
Yeah.
And I think, you know, a parent educating themselves on the disease and how to take care of the child. That's the most important thing for them.
Absolutely.
Because, you know, once you understand what you're dealing with, you could, you know, give him better care, you know.
And you can get to this point.
And they could live a normal life eventually.
Yeah, eating
you know?
pizza, playing basketball.
Yeah.
Totally normal. If there's a mom out there who wants to get in contact with you, is there an email address you can give us?
Yes. My full name, Sandra Sayru, at hotmail.com.
And that's spell it for us, S-A-N?
SANDRA-SAYROO at hotmail.com.
Thanks so much, Sandra, for joining us here on Up for Discussion. And of course, thank you so much, Justin. This has been Up for Discussion, talking about living with PKD. I've been Gail Lewis, your host today for Up for Discussion. Email me if you'd like to, newday2010@yahoo.com. And as always, thanks for joining us here on Up for Discussion. Good night.
Thank you.